Rehabilitation is care that can help you get back, keep, or improve abilities that you need for daily life. These abilities may be physical, mental, and/or cognitive, thinking and learning. You may have lost them because of a disease or injury, or as a side effect from a medical treatment. Rehabilitation can improve your daily life and functioning. Who needs rehabilitation? Rehabilitation is for people who have lost abilities that they need for daily life. Some of the most common causes include injuries and trauma, including burns, fractures, broken bones, traumatic brain injury, and spinal cord injuries, stroke, severe infections, major surgery. Side effects from medical treatments, such as from cancer treatments. Certain birth defects and genetic disorders, developmental disabilities. Chronic pain, including back and neck pain. What are the goals of rehabilitation? The overall goal of rehabilitation is to help you get your abilities back and regain independence. But the specific goals are different for each person. They depend on what caused the problem, whether the cause is ongoing or temporary, which abilities you lost, and how severe the problem is. For example, a person who has had a stroke may need rehabilitation to be able to dress or bathe without help. An active person who has had a heart attack may go through cardiac rehabilitation to try to return to exercising. Someone with a lung disease may get pulmonary rehabilitation to be able to breathe better and improve their quality of life. What happens in a rehabilitation program? When you get rehabilitation, you often have a team of different healthcare providers helping you. They will work with you to figure out your needs, goals, and treatment plan. The types of treatments that may be in a treatment plan include assistive devices, which are tools, equipment, and products that help people with disabilities move and function. Cognitive rehabilitation therapy to help you relearn or improve skills such as thinking, learning, memory, planning, and decision-making. Mental health counseling. Music or art therapy to help you express your feelings, improve your thinking, and develop social connections. Nutritional counseling. Occupational therapy to help you with your daily activities. Physical therapy to help your strength, mobility, and fitness. Recreational therapy to improve your emotional well-being through arts and crafts, games, relaxation training, and animal-assisted therapy. Speech-language therapy to help with speaking, understanding, reading, writing and swallowing. Treatment for pain. Vocational rehabilitation to help you build skills for going to school or working at a job. Depending on your needs. You may have rehabilitation in the provider's offices, a hospital, or an inpatient rehabilitation center. In some cases, a provider may come to your home. If you get care in your home, you will need to have family members or friends who can come and help with your rehabilitation. Rehabilitation is an essential part of universal health coverage along with promotion of good health, prevention of disease, treatment, and palliative care. Rehabilitation helps a child, adult or older person to be as independent as possible in everyday activities and enables participation in education, work, recreation, and meaningful life roles such as taking care of family. Globally, an estimated 2.4 billion people are currently living with a health condition that may benefit from rehabilitation. The need for rehabilitation worldwide is predicted to increase due to changes in the health and characteristics of the population. For example, people are living longer, but with more chronic disease and disability. Currently, the need for rehabilitation is largely unmet. In some low and middle-income countries, more than 50% of people do not receive the rehabilitation services they require. Emergencies including conflicts, disasters, and outbreaks create enormous surges in rehabilitation needs while also disrupting rehabilitation services. Rehabilitation is an important part of universal health coverage and is a key strategy for achieving Sustainable Development Goal 3, ensure healthy lives and promote well-being for all at all ages. Rehabilitation is defined as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Put simply, rehabilitation helps a child, adult or older person to be as independent as possible in everyday activities and enables participation in education, work, recreation, and meaningful life roles such as taking care of family. It does so by working with the person and their family to address underlying health conditions and their symptoms, modifying their environment to better suit their needs, using assistive products, educating to strengthen self-management, and adapting tasks so that they can be performed more safely and independently. Together, these strategies can help an individual overcome difficulties with thinking, seeing, hearing, communicating, eating or moving around. Anybody may need rehabilitation at some point in their lives, following an injury, surgery, disease, or illness, or because their functioning has declined with age. Some examples of rehabilitation include speech and language training to improve a person's communication after a brain injury. Physical exercise training to improve muscle strength, voluntary movements, and balance in persons with stroke or Parkinson disease. Modifying an older person's home environment to improve their safety and independence at home and to reduce their risk of falls. Educating a person with heart disease on how to exercise safely. Preparing a person with an amputation to be able to use a prosthetic and making, fitting and refitting the prosthesis. Positioning and splinting techniques to assist with skin healing, reduce swelling, and to regain movement after burn surgery. Prescribing medicine to reduce spasticity for a child with cerebral palsy. Psychological therapies for a person with emotional distress following a spinal cord injury. Social skills training for persons with schizophrenia, autism spectrum disorders or disorders of intellectual disability. Training a person with vision loss in the use of a white cane, and working with a patient in intensive care to improve their breathing, prevent complications, and speed their recovery after critical illness. Rehabilitation is highly person-centered, meaning that the interventions selected for each individual are targeted to their goals and preferences. Rehabilitation can be provided in many different places, such as inpatient or outpatient hospital settings, outpatient physio or occupational therapy practices, and community settings such as an individual's home, a school, or a workplace. The rehabilitation workforce is made up of different health workers, including but not limited to physiotherapists, occupational therapists, speech and language therapists and audiologists, orthotists and prosthetists, clinical psychologists, physical medicine and rehabilitation doctors, and rehabilitation nurses. Many other health workers, such as general practitioners, surgeons, and community health workers may also play an important role in a person's rehabilitation. The benefits of rehabilitation. Rehabilitation can reduce the impact of a broad range of health conditions, including diseases, acute or chronic, illnesses or injuries. It complements other health interventions, such as medical and surgical interventions, helping to facilitate recovery and achieve the best outcome possible. In addition, rehabilitation can help to prevent, reduce, or manage complications associated with many health conditions, such as in the context of spinal cord injury, stroke, or fractures. Rehabilitation helps to minimize or slow down the disabling effects of chronic health conditions, such as cardiovascular disease, cancer, and diabetes by equipping people with self-management strategies and the assistive products they require, or by addressing pain or other complications. As such, it contributes to healthy aging. Rehabilitation is an investment, with cost benefits for both the individuals and society. It can help to avoid costly hospitalization, reduce hospital length of stay, and prevent readmissions. As rehabilitation also enables individuals to engage in or return to work and employment, or to remain independent at home, it minimizes the need for financial or caregiver support. Rehabilitation is an important part of universal health coverage and is a key strategy for achieving Sustainable Development Goal 3, ensure healthy lives and promote well-being for all at all ages. Rehabilitation is not only for people with disabilities or long-term or physical impairments. Rather, rehabilitation is an essential health service for anyone with an acute or chronic health condition, impairment, or injury that limits functioning, and as such should be available for anyone who needs it. Rehabilitation is not a luxury health service that is available only for those who can afford it. Nor is it an optional service to try only when other interventions to prevent or cure a health condition fail. For the full extent of the social, economic, and health benefits of rehabilitation to be realized, timely, high-quality and affordable rehabilitation interventions should be available to all. In many cases, this means starting rehabilitation as soon as a health condition is noted and continuing to deliver rehabilitation alongside other health interventions. Globally, about 2.4 billion people are currently living with a health condition that may benefit from rehabilitation. With changes taking place in the health and characteristics of the population worldwide, this estimated need for rehabilitation is only going to increase in the coming years. People are living longer, with the number of people over 60 years of age predicted to double by 2050, and more people are living with chronic diseases such as diabetes, stroke, and cancer. At the same time, the ongoing incidence of injury and child developmental conditions, such as cerebral palsy, persist. These health conditions can impact an individual's functioning and are linked to increased levels of disability, for which rehabilitation can be beneficial. In many parts of the world, this increasing need for rehabilitation is going largely unmet. More than half of people living in some low and middle-income countries who require rehabilitation services do not receive them. Global rehabilitation needs continue to be unmet due to multiple factors, including lack of prioritization, funding, policies, and plans for rehabilitation at a national level. Lack of available rehabilitation services outside urban areas, and long waiting times. High out-of-pocket expenses and non-existent or inadequate means of funding. Lack of trained rehabilitation professionals, with less than 10 skilled practitioners per 1 million population in many low and middle-income settings. Lack of resources, including assistive technology, equipment, and consumables. The need for more research and data on rehabilitation, and ineffective and underutilized referral pathways to rehabilitation. Rehabilitation in emergencies. Natural hazards such as earthquakes or disease outbreaks and human-induced hazards including conflict, terrorism, or industrial accidents can generate overwhelming rehabilitation needs as a result of injury or illness. They also simultaneously disrupt existing services and have the greatest impact on the most vulnerable populations and the weakest health systems. While the important role of rehabilitation in emergencies is recognized in clinical and humanitarian guidelines, it is rarely considered as part of health system preparedness and early response. The result is that pre-existing limitations in rehabilitation services are magnified, health service delivery is less efficient, and people directly affected are at risk of increased impairment and disability. Rehabilitation is the process of re-educating those who have committed a crime and preparing them to re-enter society. The goal is to address the underlying root causes of crime in order to prevent recidivism once inmates are released from prison. It generally involves psychological approaches which target the cognitive distortions associated with specific kinds of crime committed by individual offenders, but it may also entail more general education like reading skills and career training. The goal is to reintegrate offenders back into society. Methods. A successful rehabilitation of a prisoner is also helped if convicted persons are not placed in health-threateningly bad conditions, enjoy access to medical care and are protected from other forms of serious ill treatment, are able to maintain ties to the outside world, learn new skills to assist them with working life on the outside, enjoy clear and detailed statutory regulations clarifying the safeguards applicable and governing the use and disposal of any record of data relating to criminal matters. In some cases are treated chemically, and receive longer prison sentences. Criminal recidivism is highly correlated with psychopathy. The psychopath is defined by an uninhibited gratification in criminal, sexual, or aggressive impulses and the inability to learn from past mistakes. Individuals with this disorder gain satisfaction through their antisocial behavior and lack remorse for their actions. Findings indicate psychopathic prisoners have 2.5 times higher probability of being released from jail than undiagnosed ones, even though they are more likely to recidivate. It has been shown that punishment and behavior modification techniques do not improve the behavior of a psychopath. Psychopathic individuals have been regularly observed to become more cunning and better able to hide their behavior. It has been suggested that traditional therapeutic approaches actually make psychopaths, if not worse than, far more adept at manipulating others and concealing their behavior. They are generally considered to be not only incurable but also untreatable. Psychopaths also have a markedly distorted sense of the potential consequences of their actions, not only for others, but also for themselves. They do not, for example, deeply recognize the risk of being caught, disbelieved, or injured as a result of their behavior. Criticism. Some criticisms of rehabilitative systems are that they can authorize lengthy restrictions of liberty, to allow time for diagnosis and treatment, and broad assumptions of governmental power over offenders' personalities. Moreover, due process concerns can be implicated by a lack of traditional safeguards of defendants' procedural rights in rehabilitative processes. Some rehabilitative programs, such as drug courts, have also been criticized for widening the net of penal control by sentencing more defendants to prison for violations of treatment regimes than would have gone to prison in the absence of those programs. Some types of rehabilitation programs were found ineffective in decreasing recidivism. Thank you for watching this video.